My name is Erica Stohs. I'll be working in the Department of Infectious Disease, specializing in transplant and oncology. I grew up in Gothenburg, Nebraska. I went to medical school here at UNMC. I did a combined internal medicine and pediatrics residency at the University of Arizona Medical Center in Phoenix. After that, I specialized in infectious disease at the University of Washington in Seattle. One of the great things about living in the Midwest is that it's coming home for my family. I grew up in central Nebraska, and my husband grew up in Lincoln, so coming back to work here is great because we're closer to family and we get to reconnect with colleagues and friends that are still here. So I was interested in infectious diseases because it's dynamic and challenging. With infectious disease, there's always going to be new and emerging pathogens that come to light, as well as old infections that keep coming back. I enjoy infectious diseases because you get to learn about individual patients and how they interact with the world, while also keeping a public health interest and focus. So that's I feel really privileged to be able to interact with patients who tell you some intimate details when we ask really personal questions to help them get better, diagnose and treat them. I was attracted to academic medicine, in particular here at the University of Nebraska Med Center, because you get to work with all specialties. Especially in infectious diseases, we get to interact and consult on patients, whether they're in a surgical patient or a medicine patient. So I like that I can work with healthcare professionals in all fields. And also in particular, I'm interested in infectious diseases in patients who have had transplants or are going through cancer treatments. And here at the Med Center, we specialize and take care of those specific patients. When I'm not working, I'm usually at home with my 2-year-old son, who keeps us really busy. I also like to travel, try new restaurants, and get some yoga in if I have a chance. I wanted to be a doctor my whole life growing up, particularly because I was interested in science. However, later on during college, it was some key interactions with patients with medical issues, whether it was cancer, HIV, or trauma, that really made me want to specialize in medicine.